Hi, my name is Hayley and I'm going to be your nurse practitioner today. How are you doing today?
I'm doing well. How are you?
Good. So we're going to go through your health history. We're going to start with, can you tell me your name using only your initials?
A.S.
Okay. And your primary language?
English.
And your age and date of birth?
I am 37 and my date of birth is 7/25/1984.
Perfect. And your place of birth?
Chicago, Illinois.
And what gender do you identify with?
Female.
And your race?
Caucasian.
Marital status?
Single.
How about ethnic or culture origin?
Swedish. And Irish.
Okay. And what is your highest education level?
I'm currently in graduate school for my master's.
And what do you do for work?
I'm a registered nurse.
And what type of health insurance do you have today?
I have Aetna. I have a HSA.
Perfect. So now we're going to go over what brought you in today. Tell me what's going on.
I'm having really bad neck pains. When I'm turning my head to the right and to the left, when I get to the left, it like stops me a little bit after halfway, and it really is hurting me when I turn. I can't even turn my neck all the way.
Okay. When did the problem start?
It started about 6 weeks ago.
Okay. Okay, so the onset was about 6 weeks ago, and location, it's just in both sides of your neck. Is it anywhere else?
It's mostly my left neck.
Left neck. Okay. And then when it starts to hurt, how long does it hurt for?
It's typically there throughout the whole day.
Okay.
It doesn't usually ever really go away.
And is it every day?
For the past 6 weeks, yes.
Okay. All day, every day. And can you describe the pain?
It's like an aching, but then when I turn my head, like more so, it's like a sharp pain that actually goes down the middle, like towards my spine.
Does anything alleviate this pain?
Mostly rest and Motrin. Sometimes I'll do an ice pack too, or a heating pack, and I alternate those.
Okay,
But
perfect.
that does help.
Okay, does anything aggravate the pain?
I think sitting, looking at the computer kind of aggravates it. Like when I'm typing things, that kind of does. But other than that, no.
Okay. And what are some of the things that you've done to help with the pain?
So I have done massage therapy, and I've done Robaxin to help with the pain. And then I've also tried Motrin and Tylenol, alternating them. And then of course I've tried heat therapy. And then some over-the-counter like analgesic, like topical, you know, like I can't think.
Bengay
Yes,
or something like
yes.
that. Okay.
Icy hot. That's what it is.
Okay.
I couldn't think of the word.
Okay, and then this pain, what would you rate it on a scale of 1 to 10? 0 being the lowest, 10 being the worst pain of your life.
Right now, I'd say it's about a 6. The worst it gets is about a 10.
Okay.
It really just depends on how much I'm doing and what is going on. If I'm not really doing much, it usually can be around like a 3 or 4. But once I'm driving or doing work around my house, it kind of aggravates it a little bit and it goes up a little bit in intensity.
Okay, sounds good. And then we said it was every day, all day.
Mm-hmm.
Okay. So next we're going to move on to your past medical history. Have you had any major illnesses during your lifespan?
Well, I did have COVID.
Okay.
And then I occasionally have sinus infections. I've had pneumonia when I was in high school. And last year I had ovarian cancer.
I'm sorry to hear that. Ovarian cancer. Okay. Any transfusions or disabilities?
No.
Okay. Then we're going to talk about your childhood illnesses. Did you have any measles, mumps, or rubella?
Not that I'm aware of. I did get vaccinated for those.
Okay.
The only childhood illness that I can think of was chickenpox. I did have that when I was a kid.
Okay. Did you ever have strep throat?
Not that I'm aware of.
Okay. So then we'll move back to your surgical history. So you said you had ovarian cancer, so I'm assuming you had surgery.
I did. I had both of my ovaries and my fallopian tubes removed in December of 2021.
Okay. So how has your recovery been with that?
Good. I'm recovered. I've had 2 PET scans, and both of them came back okay. And my tumor markers are within normal limits. So I'm just kind of doing routine follow-ups every 6 months just to make sure. And then I also have an IUD to help with hormone replacement and to protect me from uterine cancer.
Very good. Okay. Have you ever had any pregnancies?
No.
Okay, so no births, and you already told me about your IUD. Perfect. How about your immunizations? Are you up to date with your immunizations?
Yes, I got my flu vaccine last year. I've had my COVID vaccine ×2. I had a T-spot done for work. I've also had a tetanus this year, or a Tdap, sorry. I had a Tdap. Or was it a DTaP? I think it was Tdap.
Tdap. Okay.
Yeah. I'm trying to think what other vaccines. I have never had pneumonia vaccine.
Okay. Any psychiatric history as a child or as an adult?
No, I just have anxiety.
Okay.
But it's well controlled.
Okay, good. Any allergies to medications or foods?
No.
Okay. So what prescription medications do you take?
So I take Zyrtec 10 milligrams once a day. I also take Lexapro 20 milligrams once a day. And then I take Xyzal 5 milligrams at night. That's it.
Okay. How about any herbs or over-the-counter medications?
I don't take any herbs, and as far as over-the-counter, it's mostly just Motrin and Tylenol. I don't usually take anything else or anything stronger than that.
Okay. And the Motrin, how many milligrams do you take?
Usually 800 milligrams.
And then just as needed?
Correct.
Okay. And then how much of the Tylenol?
It's usually 650.
Okay, as needed. Okay, perfect. So we'll talk about some of your last exams that you've had. When was the last time you had a physical exam?
A few months ago.
Okay.
6 months ago.
Okay. How about an eye exam? It's been a while.
It's been a while. I'd probably say 5 years ago.
Okay. A foot exam?
I've never had a foot exam.
Okay. How about a dental exam? Do you go to the dentist regularly?
I usually go yearly
Yearly.
for my
Okay.
annual cleanings and cavity checks.
Perfect. Have you ever had a hearing screen?
Just when I was in grade school.
Okay.
I think I hear okay.
Yeah. How about an EKG? Have you ever had an EKG?
I did prior to my surgery, I had an
Okay.
EKG, so that would be in 2021. I'd say probably December.
Okay. Did you have to get a chest x-ray for that too?
Yes.
Okay, so same for that. Okay. How about your pap smear test? Are you up to date on those?
I had one in November of
Okay.
2021 by my gynecological oncologist.
Okay. How about a mammogram?
I've never had one of those.
Okay. Do you get your labs checked regularly? I guess with the.
I would say I get like my tumor markers checked every 6 months, but as far as my other labs, I usually get them done. I'd probably say, you know what, I'd probably say every 6 months as well.
Okay, okay. Have you ever had any stool studies or anything like that?
No.
Urine tests?
I've had urine, to check for urinary tract infections, but I've never had one.
Okay, and then you said you do your TB, so that's good.
Mm-hmm.
Okay, perfect. So let's talk about your family history. So tell me a little bit about your parents.
Okay, so my mom is retired. She has hypothyroidism, and she also had something with her heart where she takes metoprolol for that. I think she called it prolonged QT syndrome. And then she has arthritis, both osteo and rheumatoid arthritis.
Okay.
My dad has diabetes type 2. He has chronic kidney disease. He also has glaucoma and hypertension. I think that's it.
Okay. How about grandparents?
I don't really know too much about my grandparents other than my mother's died from cancer, and my dad's father died from a stroke, and my grandmother died from a heart attack.
Okay.
I have 2 sisters.
Okay.
One of them was diagnosed in 2021 with heart failure. She's, doing well with that, with medications and that. And then I have a brother who has really bad hearing loss.
Okay.
And then I have another sister who has endometriosis.
Okay. And then, so grandparents are deceased.
Yes,
But
my parents are alive, and both of all of my siblings are.
Okay, so then just grandparents are deceased. Okay. Do you know if anyone in your family ever had a communicable disease or any kind of illnesses like that?
I mean, the only thing that everybody's had is COVID, but
Okay.
I think with the pandemic, that's kind of
It's a
something
given.
we're seeing a lot,
Yeah. Okay.
especially as a nurse.
Yeah, exactly. So you were born in the United States?
Yes.
Okay. Do you have any spiritual or religious beliefs?
No.
Okay. Alright, so what is your perception of your health?
So far, I think that I'm in good health now that I've gotten my ovarian cancer taken care of. I'm on the process of trying to lose weight and get my neck pain under control that recently was exacerbated from working.
Okay. Alright. Any changes in your appetite?
No.
No? Okay. And you said you wanted to lose weight. Okay. Do you have any dietary restrictions or intolerances that you can't
I'm
handle?
lactose intolerant.
Lactose, okay.
If I eat too much, it gives me really bad stomach pains.
Okay.
But other than that, no.
And then how about your bowel movements? Are they normal in size, color, shape? Okay.
I typically have bowel movements every 2 to 3 days,
Okay.
which has been normal for me my whole life.
Okay. And how about your bladder? Are you peeing okay? No issues with burning or anything? Pain? No. Okay. Any incontinence?
No.
Okay. And then what's your living environment like? Do you live in a city, state, rural area?
I live in a small town called Santan Valley. It's pretty rural, I guess you would say. There's not a lot around here.
Okay.
Any
Any known exposures in your area?
not that I'm aware of.
Okay. Any known exposures at work that you know of?
No.
Okay. And we're independent with all of our, taking care of ourselves, washing and brushing your teeth and getting dressed?
Yes, I'm independent and I still drive.
Okay. Perfect. So then your roles with your family, you make your own decisions or,
I make my own decisions.
You make your own, okay. Do your decisions have impacts on your family?
At times, but I think that I help make their decisions as well.
Okay.
We're a close-knit family.
Okay, that's good. And how would you say your memory is? Do you feel that you're forgetful at all, or everything seems to be good?
Yeah.
Okay.
I don't have any memory issues.
Okay. And your judgment is intact, and all your senses?
Yes.
Okay. Do you know what year it is right now?
2022.
Okay. And then who's our president?
Biden.
Okay. And what month are we in?
May.
Okay. Perfect. Let's talk about your sleep. How many hours of sleep do you get a night?
Typically 7 to 8.
Okay.
I think I have good sleep. I don't wake up a lot. I mean, occasionally I'll wake up once or twice if I have to urinate. And then some days, like if I have to go to work, I do end up taking melatonin to kind of help me go to sleep faster.
Okay.
But on the days I'm off, I don't need to.
Okay. How about exercise? Do you exercise?
Not really, not as much as I probably should, but I do occasionally walk.
Okay. Do you have any hobbies or any leisure activities that you do?
I like to go to the movies with my friends, and I like to go shopping, but that's pretty much it. Now that it's getting warmer out, hopefully, swimming outside and that kind of stuff.
Okay. And you travel outside of the United States?
No.
Okay. And then do you smoke tobacco?
I do not.
Okay. Do you drink alcohol?
Occasionally, maybe like a monthly or less if I go out for like a dinner or something or a celebration, I do, but I don't drink that often.
Okay. Any street drug use?
No.
Okay. Do you have a partner that you are involved with right now?
Not currently.
Okay, so you don't have any risk of partner violence?
No.
Okay. So next we'll talk about some stress management. So obviously you've had some major changes in the last 2 years. You had ovarian cancer.
Mm-hmm.
How are you doing with that emotionally?
I'm well. I have a great support system, and I'm able to talk about it with my family and friends, but I haven't had any issues. So, I mean, it was a shock, of course, but I'm doing well, especially since the surgery, it was contained and was all removed. So now it's kind of just preventative and follow-ups.
Okay. And you didn't have to do chemo or radiation or anything, right?
No.
Okay.
It was caught early.
That's great. So you said you don't have a partner right now, so are you
No.
sexually active?
No.
Okay. If you were sexually active, the gender preference?
Male.
Okay. Has anything changed about your sexual function or health?
No, I mean, I do have this IUD now.
Okay. So that's new.
Right.
You never had
I don't
that?
have ovaries, so my chance of pregnancy is basically a donor egg.
Mm-hmm. Okay. Do you think you might want children?
I'm unsure.
Okay. Okay. So now we're just gonna keep going, review some of your symptoms,
Okay.
and see if you have any of them. So has your weight been pretty stable? No weight changes?
It's stable.
It's stable. Any weakness or fatigue?
No.
Okay. Any fevers?
No.
Okay. And then your skin, do you have any rash or lumps anywhere?
No.
No. Any sores, itching, dry skin?
No.
No. Any color changes to your skin?
No.
Okay. Any change in hair or nails?
Nope.
Okay. Do you get any headaches?
I do occasionally get headaches, but I think it's more so attributed to seasonal allergies.
It's bad right now.
Yes.
Have you had any head injuries?
No.
Dizziness or spinning?
No.
Okay. So any vision changes? Any eye pain?
No.
redness or swelling?
No.
And then I see you have glasses on. Are those reading glasses or are they prescription?
They're mostly for reading
Okay.
and for computer use.
Reading, computer. And you said it's been a little while since your last eye exam.
It's been about 5 years.
Okay.
Do you think I should have one?
It's probably good to get your eyes checked at least once a year. So that might be something you want to do just to make sure everything's okay.
Okay.
Do you have any issues with double vision or blurred vision?
No.
Okay. And then your ears, do you have any changes in your hearing?
No.
Any ringing in your ears?
No.
Any earaches or infections?
No.
No discharge?
Nope.
Hearing loss?
Nope.
And do you wear hearing aids?
I do not.
Okay. So you said you have sinus issues, so colds and congestion, or any nasal obstruction?
With my sinuses, I do get congestion in my noses, but it's kind of relieved with nose spray that I use and my allergy medication. I don't have any nosebleeds or anything like that, but it's mostly just I get stuffed up from the changes in the weather.
Okay. Do you notice any discharge from your nose?
No, nothing
Okay.
abnormal.
Okay. No, you said no nosebleeds. Any changes in your smell?
No.
Okay. And then when you get this, do you get a lot of sinus pain?
I do if I get a sinus infection, I'll have a lot of tenderness on my face. Currently, I do not have that.
Okay. Have you ever had any bleeding gums or mouth pain?
No.
Okay. Any toothaches?
No, not currently.
Okay. Any lesions in the mouth or the tongue?
No,
And do you wear dentures?
I do not.
Okay. And you said last dental exam was last year?
Yes.
Okay. Any issues with a sore tongue or a dry mouth?
No.
Sore throat or hoarseness?
No.
Do you have your tonsils?
I do.
And then any issues with your taste?
No.
Okay. Then onto your neck. Have you noticed any lumps or enlarged or tendril nodes in your neck?
No. The only thing that's going out my neck is I have a little bit of pain from
Just the pain.
returning.
Okay. No swollen glands?
No.
So you'd say you have pain and then a stiff neck
Yes.
and limited motion.
Correct.
Okay. Has anyone ever told you that you had a neck goiter?
No.
Okay. And then we'll move on to your breast. Have you noticed any lumps or pain in your breasts?
No.
Any discomfort or nipple discharge?
No.
Any rashes or surgeries on your breasts?
No.
Okay. Any history of breast disease?
I do not.
Okay. And do you perform self breast exams?
Yes. Monthly.
Monthly. And you said you've never had a mammogram.
No, because of my age,
Okay.
insurance wouldn't approve it.
Gotcha. Okay. And then any tenderness, lumps or swelling or rash in your axilla area here?
No.
Okay. Good.
I did have, just so you know, genetic testing done, and I do not have the gene for the, I think it's called like the BRCA gene for breast cancer. I do not
Okay.
have that.
BRCA was negative. Okay, perfect. So now we'll move down to your lungs. Do you have any cough, productive or non-productive?
No.
No. If you do ever happen to cough and something comes up, is it blood tinged or clear?
Usually when I get sinus infections, it's more like a yellowish green.
Okay.
I've never had blood tinged.
Okay. And then do you have like difficulty breathing or wheezing?
No.
Okay. Any pleurotic chest pains when you cough or anything?
No.
Okay. And no history of lung disease?
No.
Okay.
Just the sinus infection.
Just the sinus. Okay. And your last chest x-ray before surgery was good.
Mm-hmm.
And you had your T-spot, so that's up to date. Perfect. Okay, so let's keep going with the chest. Any chest pains or discomfort?
No.
Any palpitations?
No. Sometimes I might feel one occasionally if I have too much caffeine, so I try to limit my caffeine intake.
Okay. And then if you're lying down, do you have trouble breathing when you're lying flat?
I do not.
Okay. Do you ever notice any swelling in your legs?
No.
Or that they're turning blue?
No.
Okay. Have you ever been told that you have a cardiac heart murmur?
No.
Okay. Any high blood pressure?
No.
Any anemia, blood loss?
No.
No. Coronary artery disease?
Nope.
Okay, sounds good. How about appetite changes? Anything with your appetite?
No. No
No.
changes.
Okay, no nausea, vomiting, diarrhea,
No.
difficulty swallowing?
Nope.
Painful swallowing?
No.
Heartburn?
Occasionally if I eat something spicy, but nothing that's not controlled with like taking up Tums or something.
Okay.
I try to stay away from spicy foods.
Yeah. Any belching or flatulence?
No.
No. Any changes in your bowel habits?
No.
No.
I have good bowel habits.
Okay. Have you ever noticed any blood in your bowels?
No.
Okay. Any constipation or hemorrhoids?
No.
Okay. And then you said you were lactose intolerant.
Yes.
Perfect. So then, do you have any difficulty urinating, or it's painful, or it's
No.
hesitant?
I don't have any urine complications.
Okay. And then you haven't had any children, but do you do any Kegel exercises?
I do not.
Okay, and you said you use an IUD.
Mm-hmm.
So then are you not getting periods anymore?
I have occasional spotting. I also have a fibroid, which I think attributes to some of the breakthrough bleeding, but I do not have monthly periods.
Okay. Do you still get like symptoms, like if you were having a period,
You know, I
bloating,
do.
cramps?
I do sometimes get like cramps feeling, but it's very different than prior to my surgery. And the fact that I used to get them a lot in my back, and now they're more so like pelvic cramps.
Okay.
So I get them occasionally, but I don't always have bleeding with it.
Okay. Any vaginal discharge, itching, sores, lumps?
No, none
Okay.
of those.
So then that puts you into a surgical menopause?
Correct.
Is that what they told you? Okay.
I was having hot flashes, but those are a lot better now since I
Okay.
have the IUD. It helps with my hormones.
Okay.
No more hot flashes for me.
Yay.
Occasionally I will.
Occasional. Okay. But you're not on any hormone replacement pills?
No, because I had too much estrogen, and that's what fueled my cancer. My doctor did not want me to be on any type of estrogen therapy.
Okay. Alright. Okay, so we're going to talk about your peripheral vascular system now. So when you walk around, do you have any pain in your legs referred to as claudation?
No,
Do you notice any temperature differences, as cold or hot with your legs?
No.
Tingling or numbness?
No.
Any leg cramps?
no,
Any issues with varicose veins?
I do not have those.
Okay. How about any history of blood clots?
I do not. And when I had my surgery, they put me on Eliquis for a couple weeks just to prevent me from having blood clots. But I have never had a blood clot.
Okay. How long were you on Eliquis for?
I think it was for 6 weeks,
Okay.
but I'm no longer.
You're
on
done
it.
with that, okay. Any discoloration or ulcers with your hands?
Nope.
Nope, okay. Alright, so we know that you're having some muscle and, pain in your neck. Do you have anywhere else, any issues with that?
Nope.
No joint stiffness,
No.
history of arthritis or gout?
No, I do not have arthritis nor gout.
Okay, and then the only limited movement is just your neck. Is it anywhere else?
No, it's just my neck.
Okay. Have you ever been told that you have disc disease?
No.
Okay. Have you ever had a near fainting spell or near passing out spell called syncope?
No.
Okay. Any history of seizures or weakness?
No.
No. Have you ever had a stroke?
No.
Okay. Any numbness or tingling?
Nope.
Tremors or tics?
No.
No. Any involuntary random movements that happen?
No.
All right. Any issues with your coordination?
No.
Okay. How about with your memory or your mood? Any changes?
No changes.
Okay. And no history of mental disorders or hallucinations?
No.
Okay. Any history of anemia, easy bruising or bleeding?
I do not have anemia, but I do tend to bruise easily. I always have.
But every time they've checked your hemoglobin, it's been okay?
Yes, it's normal.
Okay. No blood transfusions?
Never.
Okay. No issues with lymph node swelling and no exposure to toxic agents or radiation?
No.
Okay. And then do you have any intolerance to heat or cold?
No.
Excessive sweating?
No.
No. Excessive thirst or excessive urination?
No.
No. What size shoe do you wear?
I wear a 10.
A 10. Do you know your glove size?
A medium or large.
Medium or large, okay.
Depends on how sweaty my hands are.
And no history of diabetes for you?
No, I have a hemoglobin
Okay.
A1C checked and it was 4.8.
Perfect. But just your father has diabetes?
Correct.
Okay, and then thyroid disease?
My mom.
Just mom, okay, not you, and you're not on hormone replacement. Any abnormal hair distribution anywhere?
No.
Okay. And then nervousness, anxiety, depression?
I have a history of anxiety, but it's well controlled with Lexapro. I've been taking that. My anxiety was mostly just, with the pandemic and losing friends, that kind of thing.
Yeah.
But I'm a lot better, and my anxiety is really good.
Okay, good. Any memory changes or history of mental illnesses?
No.
No, okay. Any suicidal ideations or attempts with suicide?
Nope.
Okay, perfect. Well, that's all the questions I have. Do you have any questions for me?
No, I don't think so.
Okay, thank you for your time.
Thank you.
Yes.